네, 감사합니다. 오늘 국제보건 분야에서 가장 귀한 손님인 WHO 후쿠다케이지 사무차장님을 모시고 학계의 특강 프로그램으로 행사를 가지게 돼서 회장으로 대단히 기쁘고 또 영광스럽습니다. 강한 일정이 아주 짧고 굉장히 빡빡한 회의를 다 수행하셨는데도 불구하고 저희한테 특강을 수락해서 오늘 이 자리에 출석하신 데 대하여 회원을 대표해서 감사드립니다. 저희 국제보건의료학회는 이제創立한 지 10년밖에 안 된 신생학회입니다만 작년에 서아프리카에서 발생한 에볼라열과 금년에 우리나라에서 발생한 메르스 사태를 보면 저희 학회가 할 일이 참 많다는 막중한 책임감을 느끼게 됩니다. 오늘 이 자리를 만들어주신 연대호 총장님, 김우경 의무부총장님, 그리고 실무를 맡아서 오늘 이 행사를 주관하신 최대호 교수님과 저희 학회 사무 여러분들께 감사드립니다. 오늘 이 행사가 아주 유익한 프로그램이 되도록 참석하신 여러 선생님들 많이 의견 주시고 토론 활발하게 해주시면 감사하겠습니다. 이상 인사말씀을 간단히 마치겠습니다. 감사합니다.
네, 감사합니다. 네, 다음으로 고려대학교 연대호 총장님의 축사가 있겠습니다. 큰 박수로 우리 연대호 총장님 모시겠습니다.
네, 여러분 반갑습니다. 메르스 사태가 끝난 지 얼마 되지 않았는데 오늘 귀한 강연을 저희가 고려대학교에서 할 수 있게 되었습니다. 여러분들이 TV를 통해서 많이 보셨을 거고 또 여러 가지 사태들을 지켜보실 텐데 익숙하실 거라고 생각합니다. 오늘 특별 강연을 준비해 주신 홍성태 세계보건기구 오늘 특강을 맡아주실 세계보건기구 사무차장 그리고 이 자리에 함께해 주신 여러분께 감사의 말씀을 드립니다. 신종 감염 질환과 공중보건 위기에 대해서 의견을 밝혀주실 세계보건기구 WHO 사무차장님은 국제보건 안보 분야에서 일하시면서 우리의 건강하고 안전한 삶을 위해 힘을 쏟고 계십니다. 여기까지 앞으로서 나중에 보건 정책, 보건의학으로 일을 하시면서 이쪽에 크게 공헌하고 있는 걸로 알고 있습니다. 특히 케이지 사무차장님은 메르스 발생 단기에 각 WHO 메르스 어떤 평가 단장을 역임하시면서 적시에 권고 사항을 주셨고 국제사회의 방역 상황을 정확히 공유하는 등 신속한 권고를 통해서 저에게 큰 힘을 보여주셨습니다. 이 자리를 통해서 메르스 사태와 같은 인류의 생존을 위협할 수 있는 감염병 출현에 대비하고 보건의료분야의 국제공동체계에 대해 의견을 나눌 수 있는 시간이 오늘 함께 하는 시간이길 바랍니다. 인류의 보건과 안전을 위해 존재하는 WHO와 같이 고려대학교는 1905년에 교육부국의 사명을 띠고 시작했고 여러분 잘 아시는 것처럼 우리 고려대학교 의과대학은 1928년에 여성의학을 조선 여자의학으로 시작이 됐습니다. 1980년대에는 서로 차관을 받아서 당시에 병원 의료 혜택에 불문되었던 구로공단과 방어공단, 구로병원과 암산병원 설립을 하고 여성 의료자들에게 건강과 의료 혜택을 저희가 제공한 공공성을 굉장히 강조하는 대학입니다. 고려대학교는 바이러스의 감염병 연구에 탁월한 업적을 만들어 왔습니다. 특히 신약과 백신 개발 등 신종질병 극복을 위한 연구에 매진 중에 있습니다. 특히 지난 금요일에 저희가 출범한 바이오메디칼 연구 혁신 사업화를 선도한 글로벌 컴플렉스 국주 KUMAG 잘 아신 대로 메디컬 어플라이드 R&D 글로벌 이니셔티브 센터 프로젝트를 통해서 인류의 질병에서 자유로운 더 건강한 삶을 위해 우리 모두 힘을 모으고 있습니다. 그런 의미에서 오늘 케이지 박사님의 특강은 저희의 미래 성장 동력을 바꾸고 발전시켜 나가는 데에도 큰 도움이 되리라고 생각합니다. 이 특강을 통해서 신종 감염병에 대한 위기 극복과 국제 공조 강화 방안에 대해 심도 있는 논의가 이루어지기를 기대합니다. 다시 한번 강의를 준비해 주신 후쿠다케이지 사무차장님과 참석해 주신 여러분들께 감사의 말씀 드립니다. 감사합니다.
다음은 고려대학교 영어국장이랑 김우병 비교장님의 축사드리겠습니다.
존경하는 연구위원과 홍성태 국제보건기구 연구장님, 오늘 강의를 맡아주신 후쿠다케이지박사님과 이 자리에 참석하신 모든 분들께 감사의 말씀을 드립니다. I'd like to extend my thanks and welcome to Hukuda for visiting Korea University and presenting outstanding memorable ceremony today. 연달이신 후쿠다케이지박사님은 2005년부터 WHO 복강보건복장과 복강 대유행 관련 특별 전문가들을 열거하면서 국제보건법원에서 많은 일을 하셨습니다. 이번 방문은 지난 12월 5일까지 약 50여 국가가 참여한 제2차 글로벌 보건안보 구상 고위급 회담을 위한 것이었고, 새로운 감염병 시전에 대한 보건안보 분야에서 국제공조 체계를 구축한 일로서 알고 있습니다. 그동안 감염병 위협은 개별 국가의 문제만 인식되었던 경향이 있지만 점차 인류전체의 생존 위협에 따라 국가 간 상호 지원 협력을 해야 할 필요성이 커지게 되었습니다. 올해는 벌수로 인해서 우리 의료뿐만 아니라 국가 전반에 많은 어려움이 있었습니다. 다행히 우리 의료원은 모든 교직원이 사명감을 가지고 대응한 덕분에 지역사회 감염 예방을 누리고 단 한 명의 확진 환자도 발생하지 않았습니다. 오히려 타 지역 감염 환자를 완치시켰고, 일부 의료진은 격리 병원으로 화정을 자원하여 헌신하는 것은 의료계의 부담이 되었습니다. 그런 의미에서 금일 신종 감염 질환과 공중보건기구라는 강의는 우리가 직면한 이슈에 대해 정확하게 분석하고 향후 우리 의료원이 비전을 다시금 되새기는 중요한 자리가 될 것이라고 생각합니다. 다시 한번 오늘 강의 말씀 주신 후쿠다케이지 사무차장님 감사드리고, 또 깊은 뜻깊은 자리에 참석해주신 모든 분들께도 감사의 말씀을 드립니다. 감사합니다.
So, good afternoon, everybody. I want to first begin by thanking the president of Korea University, Professor Young, and the executive vice president, Professor Kim, and the president of the Korean Society of Global Health, Professor Hong, for the invitation to come here. I have to tell you, I'm really quite excited to be here because when I am on a campus, I feel much younger, so I feel better already to be here. So thank you for the invitation, and thank you, Professor Choi. So what I hope to do is to actually deliver the lecture as quickly as possible, and then really to have questions and to talk and see what kinds of questions you have, because I think it is more interesting when it is that way. But what I hope to do in the next 30-35 minutes or so is give you a kind of feeling for some of the issues that we deal with at the global level in terms of emerging infectious diseases and outbreaks. So my background, as was mentioned, is that as a doctor and an epidemiologist, and I have spent really much of my life working on outbreaks for new diseases coming out. And so I will try to convey some of the issues that we have been struggling with for quite a long time. So the first thing is that I want to just raise the idea of health security, and what do we mean by that? It's clear that the world faces every day a number of different dangers or risks, and all of these have the potential to cause major emergencies, as you experienced when you had the MERS outbreak here. So when we look around the world, we see that there is continually the emergence of new diseases and also outbreaks of old infectious diseases. We see different phenomena. One of perhaps the infectious disease issue of greatest concern around the world now is the development around the world of a resistance to medicines against microbes. But we also see that there are things such as communities which are built in earthquake zones or flood zones, and so these are the communities when something happens, many people will die and the disruption is really quite terrible. We also have issues such as aging radiation power plants. We have seen the exposure to chemicals, sometimes chemical weapons. In the context of the Middle East, this has been an issue which has been dealt with, and it is going on. It is an issue that we are dealing with now. And as you know, when you look at the news every day, there is conflict going in many parts of the world, and sometimes diseases and conflict are mixed together. We are also in a very interesting time, however, in which the science is changing. So we are in a period in which we now deal with genetic sequences. We deal with, we have new technologies, biosynthetic technologies that can take sequences to create pathogens. And this, I think, is one of the emerging risks out there that we don't quite know where it will go, but it is one of the big emerging issues. So again, the basic problem or the basic issue is that each of these risks has the potential to develop into an emergency. But whenever we detect them, we never are quite sure, is this going to progress and develop into an emergency? Is it going to stay like it is? Will it disappear? But we do know that if a crisis develops, then we almost always see the same things over and over again. We can see that many people will get sick or will die. We will see that there is inevitably, from the beginning, a lot of confusion, but this confusion will then lead to rumors, and the rumors will lead to great deals of social anxiety. We then see that there is both disruption, so travelers will stop coming, economies will get disrupted, sometimes farming is not possible to do, and so the economic impact can run into very large sums of money very quickly, and then we see that this inevitably causes political disruption. And then I think that when you look at the emergence of some of the major diseases like HIV leading to AIDS, you can see that there are long-term consequences in changing how we do things, how we think about things. And depending on what the event is, the effect of this can be relatively short and relatively local, or it can involve the entire world, both in terms of disease and in the impact and the consequences. Now, among these many different kinds of risks and dangers, I think that emerging infectious diseases are of particular concern and I think of particular interest. This is where there is the most attention being paid to right now, and I think this is clearly because of the Ebola outbreak that we have been going through in the past year. One of the most difficult outbreaks, I think, that any of us who are dealing in this area have ever gone through personally. The other thing, though, is that when we sit back and look at the pattern worldwide, it appears very clear that the number of outbreaks, the emergence of new diseases is increasing. So to give you an example, at WHO in Geneva, one of the things that we do every night, we are monitoring the world in a variety of different ways for outbreaks. And so in this period of about 5 years, there are about 17 or 1800 so-called events which are recorded. So these may be outbreaks of disease, these may be chemical spills, these may be certain kinds of exposures. But you can see that most of them are really infectious diseases. And on this slide here, you can see many of the pathogens that we see. So things such as avian influenza or chikungunya virus and so on. Now, if we ask ourselves the basic question, why are we seeing the emergence of more infectious diseases, and why are we seeing more outbreaks? And so this could be the topic of a long discussion itself. But I think the basic reason is that because of how we are changing worldwide, this is largely the reason why we are seeing more outbreaks and why they are more complicated. So both the conditions under which we live, there's climate change going on, there's change in the environment in terms of how we are using land, there is much more travel, there's much greater contact with domestic animal populations, and that combination is creating a set of conditions in which we are beginning to see more diseases emerge. So I think this is a kind of slide that you see more commonly, but basically you can see that the world is now completely connected. It is possible for anything to go around the world in a very short period of time. But the other fact is that as we live, we are moving out of rural areas and we are moving more and more into cities. So more people now live in cities than in rural areas, and we are now having what are called mega cities, so very large cities in which the concentration of people is very high. And so you can see immediately that this will make it easier for diseases to be transmitted. People are simply living closer to each other. Now, there are the emergence of new infections that we simply don't know what it means. So, for example, if we look at something like foamy simian viruses, so see that these are retroviruses, we know that if we look in many non-human primate populations, that the levels of infection by these retroviruses are quite high, ranging from about 70% to 90%. We also know that when people are in contact with animals that are infected by these foamy simian retroviruses, they themselves can be infected. But we don't know what it means. We don't know whether there are any diseases with it. We don't know whether there will be some long-term consequences. But of course, we live in the era of AIDS and HIV, and so if you're talking about retroviruses, you always have to be worried about, are you going to see something in the future? So we don't know. But sometimes the impact of the emergence of these new diseases is overwhelming. And I think the best example in history over the last 100 or 200 years is the 1918 pandemic, the so-called swine flu pandemic. And in a one-year period, the most conservative estimates is that that outbreak caused from 20 to 40 million deaths in a single year. This is more people than died in World War I. So they're happening at the same time. More people died from this outbreak of infection. And if you look at the graph on the right side, what that represents is that in the United States during the 20th century, mortality rates were going down. And so mortality was going down. But you see that huge spike, and that was the 1918 pandemic. And you can see graphically what the capacity of some outbreaks is really to alter everything. And so this was an infection which was literally around the world within a year. But we're living in a very interesting time right now. We have a group of infections, and I put down some of the best known ones that are perhaps the most difficult for us to think about and deal with in terms of how to handle them. These are infections in which we know from the available data, from the epidemiologic patterns and from the mortality rates, that these are viruses which really have tremendous potential to kill a lot of people. Put it very simple, these are quite dangerous viruses, and we have seen that they have at times exploded into outbreaks. And we have seen that significant numbers of animals and people can be affected and can die. But then we see that the outbreaks come down. What this basically means that these are viruses, these are pathogens that we have to spend special time, give special attention to in terms of monitoring, trying to prevent, trying to be prepared for them, and trying to control them. And so I've listed probably the three that we are most worried about right now. One of them is avian influenza H5N1, the so-called bird flu. Second one is influenza H7N9, which is a virus which remains so far found just in China. And then the third one is the Middle East Respiratory Syndrome coronavirus, which you have direct experience with here. So if we take the MERS coronavirus as an example, this is a virus which was first known to infect people in 2012. It's now clear from studies done in camel populations that the virus itself has been around for much longer. But the first known human cases were detected in 2012, and in retrospect, these were people who were infected in Jordan. So there are now over 1,500 people who have been infected by this virus, or known to be infected by this virus, so they have laboratory-confirmed infections since the first emergence of this virus, and over 500 of these people have died. So you can see that if you just quickly do the arithmetic, that the mortality is quite high for viral infection. Well, the second thing is that if you look on the curve here, what you see is almost a typical curve for some of the emerging infectious diseases. So you see a beginning when the virus still first emerges, and then you see a kind of pattern. It comes up, it goes down, it comes up, it goes down. And so we are always looking to see whether there's some kind of seasonal pattern. Can we explain the basis for it? Now you see the colors of the bars. The dark blue bars represent Saudi Arabia, the Kingdom of Saudi Arabia. And so you can see that most of the infections have been there, but the bars in red represent the Republic of Korea. So you can see that this was a quite significant outbreak within the overall emergence of this virus. So this is a virus which has now been reported from 26 countries. Many of those countries are outside of the Middle East, and they represent countries in which people who were infected in the Middle East then travel to other countries. And about 78% of the known cases come from Saudi Arabia. Now, if we look at the outbreak which took place here just a few months ago, this was an outbreak which started with a single traveler who returned from the Middle East and who was infected at the time, even though he was not sick. And at that time, nobody knew that he had this infection. And as the outbreak grew, and you can see the epidemic curve for this, a total of 186 people with known laboratory-confirmed infections became infected, and 36 of those people died. And, for all practical purposes, the outbreak is now over. There is one person who continues to have an infection, but for all practical purposes, we consider that this outbreak is done. Now, one of the things which was done in this outbreak to bring it under control was to identify everybody who was in contact with somebody who was infected. So over 16,000 people were identified, and this is probably the greatest effort ever made to identify contacts of people who were infected in an outbreak. I've never seen anything like it before. The effort was extraordinary, and so virtually every possible means to identify who was in contact was used, and this led to the identification of a very large number of people who then were monitored for a period of time to see whether they would develop symptoms. And so it was a quite huge effort on the part of the government response. Now, as I showed from the earlier slides, still most of the infections have occurred in Saudi Arabia. So in this year alone, about probably over 350 people now, of whom about 10% of the people who are infected are healthcare workers. When we look at the spread of infection in Saudi Arabia, it is clear it is not located in just one part of the country. It is occurring in virtually all parts of the country. Now, one of the features of this virus, similar to the SARS virus, is that we have infections which occur in the community, but then we have a lot of the infections occurring in healthcare facilities, so in hospitals and medical centers. And so it's a quite striking feature of this outbreak. And so this year alone, there have been over 20 outbreaks in hospitals in Saudi Arabia. Most of these have been quite small. So not big outbreaks, but quite small. But there have been some large ones. And, I visited Saudi Arabia about 2 weeks ago because they had one quite large outbreak involving now over 100 cases of infection associated with one hospital. So when we look at this overall phenomenon, when we look at this overall pattern, there are some issues that we have to try to come to grips with. We see that new cases continue to occur in communities, and so no matter what we do in hospitals, if cases continue to occur in communities, there will always be the risk of people traveling to other countries. There will always be the risk of outbreaks occurring in hospitals. And the case has become quite strong in the last year or so that the primary known reservoir of this virus is in dromedary camels. And so if you go to Saudi Arabia, you will see that the association or that the culture is very strongly associated with camels. It is like having pets at your house. There's a quite strong emotional bond. There's a strong economic bond. And so this is a very strong relationship. And so what you love is also the source of a virus or a danger for you. So this is one of the issues here right now. The second thing is that we do continue to see outbreaks in hospitals. So the outbreaks that we had here in Seoul were a good example. We see the same kinds of outbreaks occurring in Saudi Arabia and also in some of the other countries. And we see some very common similarities. Crowded emergency rooms, patients who have an infection, but it's not known at the time because the conditions are crowded. Maybe the patient is in there for a day, 2 days. Actually, in the hospital in Saudi Arabia, they may be there for a few months. It is the biggest emergency room I have ever seen. It's like a hospital within a hospital. And so in the emergency room, the patient may be there for 1 or 2 months. And so these conditions make it possible or easier for these infections to travel around. And so these are also many of the same conditions that we saw in Western Africa when we looked at the Ebola outbreak. Again, people who have infection, but it's not known, crowded conditions, and then all of a sudden you have a fast-growing outbreak. So what to do is quite clear. I think that the principles of infection control in hospitals have been known for a long time. There's nothing really so new here. But the difficulty is how do you implement them? It's very hard to assure high levels of infection prevention and control all the time. And so I think this is, again, one of the issues and challenges which is now very clear to us. And so we see that in many respects we know exactly what to do, but we don't know how to make that happen. And so this is true in the countries which have the virus, and it is much more true for countries which don't have the virus because many countries simply believe this will not come to our country. And so this is somebody else's problem. So we can ask the same question of MERS as we can ask of H5N1 or H7N9. H5N1 is a virus which, when it infects people, still kills over 50% of people. It is an extremely lethal virus. H7N9 kills a smaller percentage of people, but it does not kill the animal host, and so it spreads in a silent way. So it presents a different set of problems. But with each of them, the question is basically the same. Are we going to be able to control it before it causes some large outbreak? And this is kind of the race that we are always in. And then the flip side of that question is, can we help countries and communities to be more prepared? And that is really the purpose of the Global Health Security agenda meeting, which is being held in Seoul now. The president was there, the Minister of Defense was there, the Minister of Health was there to help open up the meeting. And that is really the question. We cannot predict these things so well, but can we take steps to make sure that countries, communities, health facilities are as ready as possible so we begin to reduce some of these outbreaks? Regardless of what causes the outbreak themselves, whether it's the SARS virus or the pandemic flu virus, the costs really are quite high. And it's very clear why, again. It's when these large outbreaks occur, they are not really medical phenomena, they are not really scientific phenomena, they are really social events. So people become afraid and they don't want to travel. Or people are afraid about the food, so they will put trade embargoes on. Or people may become afraid of the food and stop eating it. There are many things which happen simultaneously, but the consequences for countries can be huge. In China, when H7N9 was emerging, they lost about $6 billion in chicken-related money simply because people were afraid to eat chicken. So the costs can be very high, very fast. Now, I want to shift gears a little bit here. I think that what I've been talking about are really traditional emerging infectious diseases. We all, in medicine and in science, have been focused on new viruses, new bacteria, new prions, new pathogens, and working at that level. But I think that in many respects, we are entering into an era which I now begin to think of as a second wave of emerging infectious diseases, which are more complex than the first wave, or the first level of concern. So antimicrobial resistance, as I said at the beginning, is probably the most important issue related to infectious diseases that we now have in front of us. And the basic picture, I think, again, is quite clear. When we look at large classes or large numbers of bacteria, viruses, or parasites, if we look at malaria and so on, we see that the resistance in these organisms against available medicines to treat them is increasing. So it's different for different pathogens. But as a general phenomenon, it is clearly visible in every country, every place that we look at, and it is visible across a very wide spectrum of pathogens. The second part of it, however, is that because of economics, because of the changing way that companies think about business, because developing antibiotics is a very expensive process and it's not clear whether you will have a successful product at the end, the medicines used to treat these organisms, the development of them has really decreased a lot in the past decade or two. And the bottom line is that we simply have fewer new antimicrobial medicines on the way. So we have a phenomenon in which there's increasing resistance, and we're beginning to see that we are losing some of the most important antibiotics available, and at the same time, we don't have replacements to come in. Now, as you know, the basic issue is simply biology. It was clear from when antibiotics were first discovered. So when Alexander Fleming first discovered penicillin and spoke about it when he accepted the Nobel Prize, he told the audience that resistance would follow, that it would develop. And the basic principle is the more that you use, the more quickly you will see resistance. And so in this slide here, what you see are a number of countries and basically how much antibiotics that you see, how much are used, and then you see the rates of infection, or rates of resistance. So this is now the topic of many discussions, and of course there are many factors which contribute to why we are seeing this develop, both scientific reasons, biologic reasons, behavioral reasons, and so on. But I just want to highlight some of them. The basic issue is that we are not using these medicines very optimally. We should use them when people get sick with a treatable infection. We shouldn't use them otherwise. But of course, we do use them many ways. People have a cold, they may want an antibiotic, and a doctor somewhere will give it to them. If we want to have animals get bigger, whether they're sick or not, we will use them as growth promoters. And so, in fact, more antibiotics are used in animals than in people for growth promotion. The second factor, though, is that the way we deal with issues is really to do an assessment, do an analysis, and plan for how we're going to handle that problem. But in fact, there are very few countries which have a national plan. So as a national plan, we're thinking about how is it that you detect the issue in your country, how do you monitor it, how do you limit sales to the right, for the right circumstances, how do you make sure that they're used in the right way, how do you reduce the number of counterfeit drugs and so on, also, how do we take the principles that we already know about, infection prevention and control, and how do we work to get them implemented? So I think these are some of the things which are needed in national plans. But the third issue that we're working on, I think, is quite interesting. As I mentioned, on the one hand, we don't have enough new drugs being developed, but the flip side is also true. The sales model for drugs is like selling cars or like selling food. If you make something, sell as much of it as you can because your profit will be high. So it's pretty straightforward. The only problem is that for something like an antibiotic or antimicrobial, it's exactly the wrong approach. And so this is a kind of systems problem. How do you make it economically feasible for companies to keep doing research, but also limit the sales at the same time so that you are not increasing resistance? And again, I think this is one of the newer problems that we are having to address. So right now, we don't have all that much information on how much the problem costs, how many people die. But if you look at the data from the European Union, you can see that about 25,000 people per year die. If you look at Thailand, they estimate that over 38,000 people die from with resistant infections. And if you look at the United States, the estimate is a little over 23,000 people. And that translates into people being into hospitals for much longer than needed, and the costs go up much higher. And, the costs go up for many different reasons, but this graph is very nice in being very clear. If you look at an infection like gonorrhea or malaria or Shigella or pneumonia, and you look at the frontline drugs, and then you look at the second-line drugs and the third-line drugs, they get progressively more expensive, and it simply costs more. And these are just the direct costs. But then if you take a look at who gets infected, if they're out of work, what is the impact, and you look at the indirect costs, they're really much, much higher than this. We are probably living in a time when this is the first time it's probably been really possible to think that we can begin to control this problem. Antimicrobial resistance is not new. For all the professors that are sitting here, they have heard about this for decades, but they've primarily heard about it in the scientific literature, in medical meetings, in infectious disease meetings, and so on. But the reason why we have the chance to actually move on this now is that this is an issue which is now being discussed by presidents. It is an issue which is being discussed by ministries of foreign affairs. So it is now moving from being a technical issue to really becoming a social issue. And this is really the reason why I think that we are possibly going to begin to reverse this problem over the next decade or so. And so one of the important things which happened this year is that there was the adoption by the World Health Assembly. So this is, in essence, all countries in the world and the health ministries who adopted a global action plan. That is, they accepted it and passed it. And what this plan does is it provides, for the first time ever, a global blueprint of what the world should do. And not just what the medical sector should do, but what the agriculture sector should do, what others should do. And so it is a kind of blueprint that everybody can look at and say, if we are going to do some contribution, this is our part of it. And you can see how you fit into really a global effort. So this is a very strong start. But plans are just plans. If it just stays at a plan, it is really a meaningless development. And so what now needs to follow is both, I think, a higher level of engagement. And what that means is that this is an issue typically which richer countries will pay a lot of attention to, and poorer countries will often say, we have many other problems to deal with. But the problems, in fact, for the poorer countries will be as great or greater than for the richer countries. And so we need to have a kind of political awareness in poorer countries, middle-income countries, and richer countries. We need to have families and mothers and individuals understand what the problem is so that they begin to take different actions. Perhaps don't ask for antibiotics when they go for a visit. And then, as I mentioned, the development of antibiotics, the development of business models is really something that we are going to have to be quite creative to do so that we manage to keep up both development of drugs, but also make it feasible to sell them at a slower rate. So if we look at antimicrobial resistance, then I believe it is the single greatest infectious disease threat of the current period. And it is also, how we've explained it to people is that it is really a fundamental threat on modern medicine. And what that means is that if we talk about it as just infections or drugs, not so many people understand, not so many people will care. They will say, this is not a problem for me. But if you say what it means is that if you develop a heart attack and you go to a hospital and you need to get a catheter in there and that catheter develops an infection, you may be in a lot of trouble. We may not be able to treat you. If you develop a urinary tract infection, in fact, it may be an untreatable urinary tract infection, and that is going to cause a lot of problems. If you have a parent or you have a child who develops pneumonia, we may be not able to treat them. And this all of a sudden moves from becoming a kind of esoteric issue to something which everybody can begin to understand. The reason why I think of it as a new kind of emerging infectious disease is that in order to do something, we are going to have to work with agriculture. We're going to have to work with defense. We're going to have to work with foreign affairs to address it. And in medicine and in public health, we don't know how to do this very well. We know how to deal with scientific problems quite well, but how to deal with that larger issue is something that we don't do as well, but we have to. And so I think that we should begin thinking of things like antimicrobial resistance not so much as a medical problem as so much as a social issue. And this is really, I think, the change in why it is now possible to think about reversing this. Now this is the last slide, or I have one other slide after this. But the other issue I wanted to raise is this issue of emerging technologies and why it is also something to think about as an emerging infectious disease. Again, right now we are now living in the era in which we frequently just automatically look at what are the genetic sequences of pathogens. So if you read a scientific article and it's about this organism or that organism, you expect to hear about the sequences. You expect to hear about an analysis of that. We now have the technologies to take that kind of sequence information and actually turn it into organisms. The most sophisticated laboratories using available synthetic biology techniques can do that. So then the question comes up, or the third change which is going on, is that technology is now becoming cheap. And when I mean cheap, I really mean cheap. We were at a meeting and somebody did a Google search right then and there and looked for used machines that were capable of taking the sequence data and converting it into organisms, and it is on the order of a few $1,000s. So what that means is you can now begin to imagine as we go forward, and this is actually happening now, people are using these machines in garages, they use them in kitchens, they use it at home, because you can use that to make products and you can sell that, so it's a good business opportunity. But that combination of cheaper technology, of more scientific power, is the ability to begin to create things which were not possible just a decade or two ago. And so what does that mean? Again, nobody really knows what it means. You can create a lot of different scenarios, but nobody really knows what it means. But the potential for that, for somebody to begin to engineer and create new organisms or to modify new organisms, is clear. And so this is now an issue of increasing discussion and increasing concern. And it's very interesting to see where it will go. But I think that it is really the beginning of a new era in terms of infectious diseases again. So I think this is my last slide. So the basic point is that we have in the world a number of risks, health security risks, and they are health security risks because all of them have the potential to go from a relatively low level to explode and cause some kind of social crisis. Emerging infectious diseases are particularly important among that group. One is that because it is the most common event that we see, it's what we detect most often around the world, and it is also one of the most complex for the reasons that I mentioned. We don't often know how things are going to go forward with these infections. Now, the current strategy, the current global strategy for dealing with these kinds of emerging infectious diseases is really covered in something called the International Health Regulations. Oh, sorry, I think there is a little bit more. What the International Health Regulations are, and I think that this is something that you don't usually hear about in medical school or in hospitals, but the International Health Regulations is a legal treaty among virtually every country in the world, and it is kind of like an umbrella, a public health umbrella. And the reason why it is that it is the agreement, it is the rules among countries about how they will share information when they know something is going on. It provides for roles and obligations, what you should do under certain circumstances and agreements. And so this is true for countries, this is true for the World Health Organization. And there is a very strong emphasis on making countries strong enough so that they can jump on outbreaks when they are small so they don't get big. And there's a very strong emphasis on when an outbreak occurs, there is as much coordination as is needed between countries, between organizations to deal with that outbreak. And so this is part of the reason why the Republic of Korea invited WHO to come and work with the country in terms of the outbreak a few months ago. This again is part of the modern strategy. Okay, this is the last slide. So having said that, so that is kind of a conceptual, legal, almost philosophical framework, but it is really the global foundation for how we think about these things, how we deal with them. But within them, the core public health principles still apply. So prevention, trying to prevent infection before they occur, having good monitoring, good detection, having good disease control, and having good risk communications. Risk communications is probably the most difficult of all of those things. We continue, of course, to emphasize the primary importance of science and evidence. If we don't have that, we're lost. But the third thing, and this is something that you really see its importance in global discussions when you have different countries sit down, is that you cannot think about the control of infectious diseases or these new emerging technologies if you are also not thinking about equity, what is fair, if you are not thinking about access, if there are new technologies, what does that mean for poor countries? It's clear what it means for rich countries, but what does it mean for poor countries? And you have to be thinking about that from the beginning. You have to be thinking about issues such as governance and accountability. And so these are things in medical school I never heard about. I was never taught about that this is important in terms of infectious disease control, but it is completely important for infectious disease control. And it is definitely important for the thinking about as we go into the future how we will deal with these things on a global level. So with that, let me stop and thank everybody for coming.